Hi everyone, my name's Irene Scott. I'm the project director for the Internews COVID-19 project. Thanks for tuning in to my video. I'm going to have a discussion about rumours, stigma and COVID-19. I'll be looking more generally about how rumours are affecting this crisis and the role that they have in terms of influencing stigma and prejudice throughout the region and throughout the crisis more generally globally. You'll see there's some links that you're more than welcome to visit, our Twitter and our Facebook and our website. That project website there is really focused on providing tools and resources for journalists and communicators to improve their response to COVID-19 and to be able to address some of the major rumours that are circulating throughout the region. Okay, so why is understanding rumours so important in this crisis? This crisis really has a global impact. We're not looking at a localized crisis. Many humanitarian crises might be in one region of a country or one country or perhaps even two countries across border. But we're really looking at the global impact here. And it also means that misinformation and rumors about this crisis also spread globally. So while they might start in one part of the world, we do see them spread across borders and influence the debates that are happening right around the globe. Of course, it's an infodemic. It's a term that you've heard many times, I'm sure, already. But it basically means that there's just too much complex information out there for people to be able to synthesize or to understand this information. Because there's so much information out there, there just purely aren't enough hours in the day to read everything. But also a lot of the information that is out there, especially around vaccine and drug development, is really complex information. So there's a lot of room there for misinterpretation and misunderstandings. And that also can be the root or the beginning of rumours as well. You, of course, also have the lab of social media. Now, social media is not impacting every area. For example, the Rohingya camps, obviously, in Bangladesh have less of an impact from social media. But in general, this crisis it means that really everyone can jump on social media and claim to be an expert. That might be people that are trying to sell particular products, that are trying to breed division within our communities, or purely to look like they know what they're talking about. Social media means that everyone gets a platform to say what they think. And of course, trust. Trust is really key in any humanitarian crisis, but especially in this crisis where a lack of trust could really lead to people not being tested, not being treated for COVID-19, and of course that leads to the ongoing spread of the disease. When we're looking at rumours and when they're especially powerful, whether they're on social media or spoken face-to-face communication or wherever they find themselves, rumours are always more powerful when they're the only source of information. So if we have a community that doesn't have access to quality, accurate, trustworthy information, rumours can then be much more powerful. People need something. They need an answer. And if the only thing you can grasp at is a rumour, then you'll go with it. They're more powerful when they align with already held beliefs. And that's really important when we're looking at ideas around stigma, because if I already have a prejudice against a certain group in society, for example, and I hear a rumor about that group, I'm much more likely to believe it if I already have a prejudicial belief against that group. Rumors are also more powerful when they have a kernel of truth. So that basically means that, part of the post or part of the story might be true, but then the rest is not true. So it builds on true information to kind of lead us astray. It gives us that moment where we think, this bit's true, so maybe this other bit's true as well. Rumours are also really powerful when conditions are difficult or distressing. So when we're anxious, afraid, we don't know what's happening in our world, there's a lot of change happening, people do cling on to the information they can find because we're feeling distressed. Also, when there's a motivation to accept the rumour, again, if I had a prejudicial opinion of a certain group in society, and it would be in my best interest to accept that rumour, to believe that they're the cause of the virus, for example, because that means that I'm not the cause, then of course rumours are much more powerful as well. And when they cause a strong emotional reaction, a fear, disgust, anger, happiness, hope, these kind of the things that really pull on our most core emotions, we're much more likely to believe rumours like that. If a rumour is about a very mundane topic, if it might be about, this particular breed of carrot is tastier than another. It's, not very exciting. No one's going to get too emotional about a carrot, for example. But if it's about our core beliefs, about religion, about the way our society operates, those are the things that really get us angry or happy or sad. And it also means it fuels that rumor. And of course, when they're told to you by someone who you trust. Any information coming from someone you trust, you're much more likely, of course, to believe that information. And that's really important when we're looking at the role that community leaders and religious leaders, for example, play in spreading, unintentionally, most often, spreading misinformation around this virus. But to go a little bit deeper into the psychology of rumours, because I think it's really useful to remember that it's not always that people are trying to intentionally bring people down the wrong path or to make people believe things that aren't true. Humans are ultimately quite flawed creatures, and there are a number of psychological reasons that we believe rumours. And so when we're looking at who else believes, humans do think in groups. So there's one concept of group polarization. So that means basically that one group begins to have one opinion about something and therefore influences other people in the group. Maybe you could think about a group of friends that you have, and maybe you all particularly like one band or one singer or one particular type of food. And, for someone in that group to suddenly say they didn't like that thing, they wouldn't feel part of the group, part of your tribe that you're establishing there. So groupthink is really important, but also information cascades. And that's the concept where the more times you hear that piece of information or see it, perhaps on social media, the more likely you are to think that it is true. So if I see something that's on Twitter, for example, a rumor that's being spread, if I see one person spread that rumor or tweet that misinformation, I might think, that's just one person. That's probably not true. But if I see hundreds of people tweeting that misinformation, people do start to think, well, maybe hundreds of people couldn't be wrong. So there is that at play. But I think the challenging thing in this crisis is that we're constantly trying to replace rumours with facts. And because of the way humans think, facts aren't always enough to defeat the rumour. There's the concept of anchoring. So anchoring means basically that when you have a belief about something, it's very hard to change someone's mind. So, if they believe one thing about the virus or one thing about how the virus spreads, presenting them the facts doesn't always change their mind. You need to have a really good argument. You also have the backfire effect to think about. So for some people, when you present the facts that might not be in line with the way they see the world or the way they believe that something is playing out, they can actually double down on their belief. So it might mean, for example, if someone believes that a certain group in society is at fault for spreading the virus, and you show them the facts that that's not the case, they might believe their original thought even harder. But also you have confirmation bias. So that basically means if I have an opinion about something, I will consciously or sometimes subconsciously always look for information that backs up my belief. Select the information that confirms what I already believe. So as I said, humans are just not perfect rational creatures. There's this great quote here from George Orwell where he says, "People can foresee the future, but only when it coincides with their own wishes, and the most grossly obvious facts can be ignored when they're unwelcome." So when we're afraid as well, we want to blame someone, and that's where stigma really comes into this crisis. So rumours have inflamed existing prejudice in our societies. So it might, in some societies, we've seen where there was already anti-Chinese sentiment. COVID and rumours around the source of COVID have inflamed that anti-Chinese sentiment. But of course, vulnerable groups as well. These might be the more marginalised groups in our societies: migrants, foreigners, refugees, minority groups, LGBTQ plus communities as well. Rumours and COVID have made situation and drawn a bigger division between our society in that way. But they've also fueled new prejudice. So that new prejudice we're often seeing it being directed towards health workers, towards patients and their families who might have recovered from COVID-19. We've seen, several incidences of recovered patients who are no longer infected, not being allowed back into their villages, being shunned from their towns, but also journalists who are seen to have, high interaction with people that may be infected in their work. And in many instances, we have, of course, social media spreading this prejudice at an alarming rate. This is some research that came from IFRC where they asked people, do you think a specific group is responsible for spreading COVID-19 in your community? And you can see here that about half of the people thought yes, or even a little bit. So that's where stigma really comes from, stigma and prejudice, where we start to believe that it's a particular group in society that is at fault for spreading the disease rather than the conditions that they are forced to live in. So when we're responding to rumours, I'll have a few tips of things to think about when we have rumours in the communities where we're working. So first, of course, is to do no harm. And this is something that we hear around the oath that doctors take, of course. Also, journalists, of course, start with the concept of doing no harm. And as humanitarians, it's really important for us as well, of course, to stand by our principle of doing no harm in the work that we do. So thinking about our actions and what could be the possible unintended consequences. So responding to rumours, building trust. As I said earlier, people are more likely to listen to rumour or even listen to information when it comes from a trusted source. So making sure we build trust with the communities where we're working, being transparent, correcting our faults, and being, quite transparent, of course, when we don't have all the answers. That's really common in this crisis, that we don't always have the answers to questions, but to be able to say that. Language, of course, is important, making sure that we use plain language when we're explaining complex topics related to health and medical science, and also to think about the language that we're using and who that might exclude, especially in the Rohingya crisis. We need to make sure that we're speaking the Rohingya language and speaking it using a terminology that is really accessible to the widest audience. Listening, all good communication starts with listening. So listening to what your community is talking about. What are the hints towards stigma and prejudice that might be arising in the community? Understanding the fears and anxieties and things that your community are talking about gives you a much better standing to then respond to them in your activities. But then also responding to actual, not only perceived information gaps. Definitely at the start of the crisis, it was really important to get information out there about washing hands and the basics of how the virus spread. But now that we're, quite a few months into the crisis, it's really important to make sure we listen to the actual questions and concerns coming from the community and respond to those, to treat it as a conversation rather than dictating information to our community. And I think this picture really illustrates it well, that of course we have a lot of rumours circulating in this crisis, and we think that if we just have as many facts, we'll be able to defeat them. And unfortunately, because of the psychology and how humans work, it just doesn't work that way. We need to build that trusting relationship and listen to the actual concerns of our community. And that's how people will listen to the information that we're providing, and it can ultimately be much more useful to them. Also making sure we provide localized advice. I've seen quite a lot of communication campaigns that say wear a face mask, and that's wonderful. In many contexts, wearing a face mask is a really useful way you can help prevent the spread of virus. But for many people, they don't have access to a face mask. You can't just go down to the market and buy one. They're not accessible, or people might not have the funds to buy one. So make sure if you're giving someone a direction or some advice of things they can do, that it actually fits their context, that it's something they could actually realistically do where they live. And that goes on as well to making sure the information we give people is actionable, giving people something they can do to feel part of their recovery. And of course, to keep listening. Even the most simple direction that you give your community will have questions. For example, again, wear a face mask. You might have the questions of, where do I buy one? What type of face mask? How do I wear it? How do I dispose of it? There are always more questions, and we need to make sure we keep listening and have this conversation with the community to make sure we stick with them. And that's how you ultimately build trust as well, so that they know they can rely on you for that ongoing information. And of course, when we're looking at stigma, to make sure we're amplifying the voices of those marginalised groups, making sure we give them the platform to make sure their voice can be heard and that they're humanised in this crisis. And of course, that we're meeting their information needs as well, that might be more complex or different to the information needs of other groups. Acknowledging fear is really important. Everyone is afraid and anxious and a bit on edge in this crisis. We're not here to increase levels of fear, but we can try and fight that fear with compassion and acknowledging that we're all in this together. And that also goes into encouraging community-based solutions. Often when people are afraid or anxious, we double down and we look after ourselves and our family. We become quite individualistic. But in a crisis, it's actually really important for us to remember that we are working as part of a community, and that this is really the only way to defeat this virus is that it's a community effort built on individual efforts. So, every individual needs to do the right thing for the good of the community. And of course, reimagining the new normal. I think many of us can attest to the fact that our communities were not perfect before this crisis. So work with your community and say, okay, well, if things do need to be different down the track, if things do need to change because of this crisis, what can we do to make it better? And what can we do especially to make it better for vulnerable groups that might be facing more stigma and prejudice now, who might have been facing it for some time? But how can we use this as a turning point for our community to wipe out that kind of stigma and prejudice? And there's this great quote here from Sonia Renee Taylor, where she basically says that we're being given the opportunity to stitch a new garment, one that fits all of humanity and nature. So that's all from me. Thank you for listening. I look forward to seeing you at the webinar. You can find there some contact details. Please do visit our website for some more resources, and I will talk to you soon. Thank you.